piece of kinesiology tape, our postural Procut, at the highest level of both tennis and golf. I've used it with people who are playing for world ranking points. I've been to Wimbledon in a semifinal with this Procut. I've been on the highest stage of amateur golf with this Procut. And this really is where this posture fix is separate and different from all other types of postural correction devices. And the unique thing is that you can use this while you're competing at a high level. You can wear this while you're at the gym, while you're at a board meeting, while you're talking to your parents. And that's the difference. All the other postural correction devices, they take us in a position where we're kind of stuck here, and it's quite obvious that we're wearing the device. This postural correction goes unknown to everyone else around you, and you can compete at the highest level. And it's simply because the postural Procut, what it provides for you is a reminder. It gives you a reminder to get in the position that you would like to be in. It's not a full stop brace that restricts your ability to get through full range of motion. Which leads us into what our goals are for today. And they're quite simple. Our goals for today is we want to learn about the Procut and how this can help your posture. And the one thing I'll add is that this is going to help your posture after your treatment in most cases. And then the second thing is let's learn how to apply the Procut. So the next time you step into the clinic, you can apply the Procut and you're comfortable and confident applying it to your clients, and they get the best experience possible. Oh, and then one thing I'll add is at the very end, just like our first webinar, we are going to do a Q&A to go over any questions about this, but also anything that's come up in your mind over the past month since we did our first webinar. Great. We'll start with the advantages of the Procut, and when I say the Procut, I mean this postural Procut is one of our pre-cut kinesiology tapes that is designed for a specific part of the body. But we'll go over the advantages of that initially, and that's simply because this is the reason why we're here today. This is the reason why we can provide these great products to our clients and customers. And this is why we can help so many people, is because we put so much time, effort, and care into coming up with a product that is perfect for the parts of the body that you want to apply it to. So it clearly is, it's standardized, it's simplified, it makes life easy and simple. It's long lasting because it's all machine cut. The corners are all rounded. There's no cutting involved. There's no fumbling with tape. The backing paper is nice and thick, so you don't have to touch the back of the tape affecting the adhesive. It is reproducible because it comes the exact same way every time. And then all of these things come together to save you time in the clinic, whether it be just applying the tape itself, and that doesn't take any more than 30 seconds once you get good to it, get good at it. But also in terms of note taking and just knowing what you did the previous time with that client. All it takes is just providing just letting yourself know that you applied it to your client last treatment, and then it's so easy to know exactly what to do the next time you see them, assuming that there was a good experience as we would expect. And then the last piece there is a little different in that it's looking at applying it outside the clinical setting. And this is where, with this particular piece, I think it becomes very important in that so often I'll apply it to one of a patient or a client, and their husband, their wife, or their parents now want to know how to do it because now their son or daughter isn't on the computer all the time, or when they're on the computer, when they're using their phone, that their back isn't rounding forward and they're not developing that bad posture. So this enables you to provide it to the parents or the spouse of your clients, and they can do this at home. They can apply it on their own and continue the benefit of this postural Procut. So we'll go over a couple of the interesting pieces to remember as you get used to applying this Procut. And again, remembering that the whole point of this, and I think it's pretty clear, at going between the shoulder blades over top of the spine, is that this is designed to reduce a rounded forward position of the back. It's designed to counteract a big kyphosis in the thoracic spine. And so how we'll generally apply this is you want to do it without having to stretch the tape. And we'll go over exactly how we do that. We're gonna reference our most recent education piece on our website, which you'll see, and it goes over the application of this Procut. And so we'll go over how we can make sure not to stretch the tape. And then the second piece, which sounds very similar to that, but is very distinct, is you want to make sure you never stretch the end pieces of the tape. And so this is where we get into the most common issues with people having bad experiences with the tape. And if you can picture on the skin, the tape, what it is, our kinesiology tape, what it is cotton fabric with an elastic property to it. So the elastic property is the secret to how it is so successful. But the elastic property also retracts back on itself. It lifts up the skin. But the retraction back also, at the point where the tape begins or ends, there is a distinct line beyond that where we don't have tape. Where we don't have tape, there's no pull in the skin. Where the tape begins, that's where the pull begins. And so if we provide extra stretch, or in turn extra retraction backwards, that's where we're going to have a fault line of the tape pulling back on that area of the skin. And I would estimate probably 99 times out of 100, that's where we end up with people having bad experiences, reactions to the tape, is that they've unknowingly applied stretch to the tape at the end of it, and all of a sudden we have that fault line, and then we get a bit of a reaction or a tear in the skin as a result of that. And then the last pieces, we want to make sure not to maximally stretch the tape, and we'll go over this again. And the end of the day, you as the clinician have the ability to decide how much tension, how much stretch you want to apply, depending on where we're putting it, and really what the needs of your client are. We're going to be before we look at our masterclass and we kind of look at how we apply it, we're going to look at a couple different studies here, and they kind of help tell a story as to how we would use the tape and how we can expect the results of this Procut to be. So in the first study, we're going to look at combining our Procut type application with stretching of the pec minor on both sides, and how much effect that has on a rounded shoulder posture. Quite simple. This study is very simple. It's straightforward. They looked at 2 weeks, and what do they find after the 2 weeks? So if we go back to we have these two groups. The first one is just stretching. The second group is stretching and our kinesiology tape. At the end of the stretching alone group, at the end of the 2 weeks, we saw a 9% improvement in the rounded shoulder positioning of the shoulder. So their posture improved by 9%, which is great. 2 weeks of stretching is very effective. If we look at the stretching plus kinesiology tape group now, instantly, as soon as they put the tape on, we saw a 20% increase or improvement in the rounded shoulder position of the people in the study. And that makes sense. The Procut goes on the back, it retracts back, it gives you a reminder, oh, I want to get away from here, I want to be here. And so when you go for measurement, all of a sudden your normal standing posture gets improved, and now we saw a 20% benefit after that. If we go 2 weeks later, and then we take off the tape, and over those 2 weeks, every day we wore the tape and we stretched our pecs. We take off the tape, and then we check our posture again, and that's where we continued to see a 19% improvement in posture once the study was completed and once the tape was removed. So the idea being is that the position that we establish is longer lasting than just the tape being on the back, which is fantastic. The next study we'll look at, this study goes a little bit longer, in that this is a 6-week study, but the difference is that there's no stretching. This is just tape goes on the back. This is just see what the posture looks like before and after. So a little more straightforward. And as we work through our graph here, if we look at the bottom line first, so if we see after 6 weeks that we have a 28% improvement in and the control group received postural advice. So after that, with postural advice, people improve their posture by almost 10% after 6 weeks. The second piece there, the 28%, that was after the 6 weeks is done, we saw a 28% improvement in the posture. The 21% above it is if we take the tape off for 2 weeks and then re-evaluate, then we still see that there's a 21% improvement from our baseline, even 2 weeks without using tape. So 8 weeks after we started. The interesting thing from that or beyond that is the two next pieces they looked at was the ability for the rib cage to be pliable, to expand. And we saw these big improvements of 33% ability to expand the rib cage in the kinesiology tape group, 23% 2 weeks after the tape was removed. And then the last group, we looked at the ability to expand the lungs. Primarily, this would be a determination of your diaphragm strength. And we saw that after the 6 weeks of just improving your posture by wearing the kinesiology tape, we saw a 12% improvement in the strength of the diaphragm. And then interestingly, even 2 weeks later, even after our study is complete, the tape has been removed for 2 weeks, we saw a 14% improvement of the diaphragm strength. So just improving your posture, all of a sudden we're breathing more effectively, and the diaphragm gets stronger, which makes total sense with what we do all day, every day in clinic. So to give some ideas and what you can expect would be the moment you put the tape on, we can expect a 20% improvement. If we combine that with stretching, we can get that 20% improvement a whole lot faster. And then if we were to add a third piece, which would be soft tissue therapy with our stretching, with our tape, I would expect us to double those numbers. I would expect to see a big improvement, much bigger than even the 20%. And I would expect us to get there faster. So that's the variable we didn't see in these studies, but that's the variable that we can provide, and the variable that I think that would make a huge improvement within this study. And if anyone has an in the university, that might be a good place to start as well. So that kind of takes care of the why and this kind of the idea, the science behind our postural Procut. Let's dive into our second piece, which is how do we apply it? And as you can see, this would be the image of our Procut. Generally, it's going to be between the shoulder blades. Generally, it's going to be in this location, but you do have the ability to make the clinical judgment of where you place it based on the spine shape of your client. All right, so we're gonna reference our master class. This is our application video for our postural Procut. We have all of our Procuts on there, application video wise. In addition to, we have educational information as to the science behind using our kinesiology tape for the first time, but also some very good information for people who have used it for years and they just want to learn, go deeper, a little bit deeper into what the tape is all about. So we're going to use the imaging from our masterclass, and I will explain what's happening as we go. So when we kind of first have our tape, we're going to apply it to the spine of our client when they're in a nice relaxed position. We see here that we have the numbering system on the backside of all the Procuts. This tells you exactly the order to apply the tape. We know that after we break all the perforations, and the perforations being those nice obvious black lines when you get your hands on the tape, it's be obvious that that's where you want to bend and break the perforations from. And that exposes the tape and makes it extremely easy to be able to apply. And as we work through it here, the reason why we're going to apply the number 1 strip, which goes along the spine, with our client relaxed, is we don't want their skin to bunch up. We want the tape to be able to get on the back of our client, grip the skin, get kind of flush contact. And if we do achieve that, our Procut will be on there for days on end. So as we see here, we're going to apply the number 1 tab. And with all of our tape, the adhesive is heat activated. So after you get the tape on there, you want to give it a rub to create some friction with your hands. And that will ensure that we get good skin contact and we have a long-lasting application. Once we have the number 1 tab on there, we can retract the shoulder blades. And generally, people do it a little too much. Generally, you want to just have the person turn their palms forward, create or take an anatomical position, the position where kind of essentially we put the person in the position we want them to maintain. So that's the position we want to promote, which is the anatomical position. And then from here, it's really simple. We just apply each of the remaining strips perpendicular to the ground across the shoulder blades like that. You want to do it in a nice relaxed way. And the way that I'm applying it here, because they're taking the position we want to promote, we don't have to add stretch to the tape. The other option would be to have them take their normal position, like kind of their relaxed position, and then try to stretch it in a uniform way. But if we do that in this manner, where they're taking the position that we want to promote, we can apply without stretch. And the benefit there is that we can get a nice, thorough, consistent stretch throughout the entire application, and we don't have specific places on the application where we have more stretch than others. And as I mentioned before, the places we get more stretch is where we can expect potentially issues to occur. So this would be the way that I apply it with 99% of the people that I work with. In that I can do this, I can apply it in a way that I know that we can limit all issues because we have that nice consistent stretch throughout. Right. So if we circle back and look at what our goals were, very simple. We were looking at how the Procut, the Spidertech postural Procut, can help with posture. And again, the idea being that in most cases, this is your finishing move. This is the thing that you would do after your treatment. It would be the last thing you do before the client leaves. And then we also looked at exactly how to apply the Procut. Well, again, you can go back and look at that masterclass video on our website to go over it as many times as need be. The last thing we'll leave with is the lasting impression that we at Spidertech want to maintain with you as a clinician, but also with every one of your clients. I find, because I know what the capabilities of Spidertech are, there is a way that I can apply with every client. There's tape for every client. And whether it's muscle tension, swelling, bruising, improving proprioception, injury rehab, or just trying to decrease pain. And then today, as we went over improving posture, there's one of these categories pretty much fits in with every client I work with. And so that's why I can help every client at the very end with our tape. The other thing is that because I refer to this as the treatment between treatments, there's nothing else that I would normally do. This is taking the place of. This is what I'm applying to my clients. They're going about their normal day, and then they come back and they've had therapy throughout the entire time that we weren't together. And so this is where our tape is in a category all by itself, because normally there'd be no therapy involved. There might be education in terms of postural issues or exercise, but the reminder from our kinesiology tape makes those two things even more effective. And then commonly, I'll have patients come back and said that people were asking about what the tape was all about that they're wearing, whether that's friends and family. And so many times it's the start of a conversation between my clients, my patients, and the people that they care the most about, or the people they meet in the street. And so inevitably my name comes up as a clinician, and people are talking about it. So that's why many times it's like a high quality business card having the Procuts on your clients. And because they are so high quality, they come designed for that specific part of the body. They look fantastic, and they also work as well as possible within the kinesiology tape realm. So that concludes our second webinar. Let's jump into some Q&A right now, and we'll tackle any questions that you have about our postural Procut, in addition to any questions you have in general about tape, and how you can use it to help your clients. But I think the easiest way here is either unmute and speak your questions, or just type it in the chat, and I'll do my best to cycle through those. So the first question, is there a class to take to get certified? Let's see here if I... I'm going to widen this up so I can see the rest of the question. Okay. Is there a class to take to get certified? And the answer is the class as it stands right now is on our website. It is completely free of charge, and it can be used for your continuing education credits, as it's private reading and information that you're learning. We are working on the certification piece as it stands. We're making sure that we can effectively test your ability both to know the information, but also to get your hands on the product. And we want to be able to test your physical competency and applying the tape to your clients. And so we are working on the certification piece, but the information as it stands is there for the learning, and it is free of charge. You're welcome. And I said it before at the beginning, but the piece that I find so fantastic about this particular Procut is that you wear it throughout the day, and it only makes things better. It doesn't interrupt your range of motion. It doesn't interrupt, or there's no downside. It's just that little reminder as to where you want to be. And so anyone from someone who's about to go through a big meeting to your children at school, kind of throughout and everyone in between, this is who can benefit from this Procut, and it's probably the most versatile piece that way in terms of like the population that it can help, that I apply with people in the clinic. Yeah. So the normal place thanks, Jeff. The normal place that we would apply it would be right between the shoulder blades. So, I mean, depending on the curve in the person's spine, that would determine where we apply. But certainly, kind of that mid-thoracic area is where we'll be. And many times I will aim with the upper and lower sections. I will aim that to cover the top and the bottom of the shoulder blade, like as a general landmark for where we want to apply it. I find that way it works at restricting this particular range of motion. If I go higher and lower than that, it's going to restrict a little more of like the flexion extension forwards and backwards in the spine, versus between the shoulder blades, we get a little more of the rounded shoulder position where that's where the limitation is, or that's the reminder comes with is like restricting extra rotation through the mid back. Is there other uses for this cut? Yeah, absolutely. This kinesiology tape can be applied anywhere that you would like. Our Pro Cuts are designed for that specific area of the body. And for example, we have one for the low back, one for the knee, for the ankle, the shoulder. And so that's where the design and specificity is for. But if you have another area of the body that this can go on, then by all means, you'll still get the same very high benefits. I would also use this either kind of above and more in getting up to the neck, or moving it down a little bit, getting more into like the lower mid back. If we're just trying to restrict a little bit of flexion extension versus rounding forward to kind of build off the previous question that Jeff asked. So yeah, so the beauty of it is that you get to use your clinical judgment, and you get to get the most out of the product, and that's really where the benefit is of someone coming to you as a clinician versus pulling it out of the wrapper on their own and applying it at home. So the next question is, how do we manage draping the client for this application? Yeah, it's something to certainly consider. There's many ways that I will do it, and so I'll take the normal assumption that I'm applying it while the client is standing. They've taken anatomical position, so I'm behind them. They're standing like so. Generally, what I'll do is I want to expose the back, and if people aren't comfortable with that, then we can work around clothing. But if I expose the back, what I'll generally do is have the person take their arms out of their shirt and kind of just like pull their shirt in front of them, if I feel like there's an issue with them removing the shirt in general. And so that way they're still the shirt's kind of in front of them, and I still have been able to expose their back. If we're talking females, again, you're working around the bra or sports bra, and I find that to be no issue. You can get it on there. You can move the straps around, and applying this around straps is no problem whatsoever. Again, I think you just want to use your judgment. You also can grab a gown and gown people if you feel like that's something that they would like to do. But I would say use your clinical judgment and always be conservative as to, I mean, me personally, leave as much clothing on as I feel like there's comfort level. I'll also, if people are around, I'll kind of call someone into the room to kind of help them with moving the clothes around, just so everyone feels as comfortable as possible. One question I'll build off this that I've been getting recently with especially with massage therapists who are used to working with people when they're face down, is, can I apply this to a client when they're face down? It's generally going to be the last thing that you do after you're finished your therapy session. Can I do it when they're face down? And my thought initially was, No, I think you wanted to just come and make it kind of a standardized, reproducible way of applying it. But the more I've thought about it recently, I think that maybe the right answer is you want to figure out what your client is going to be using it for. So if they're at a desk all day long and their normal posture is like this, if they take anatomical position, well, maybe that's too much stretch because maybe they want to get forward, and so like this position is too much of a variation. And so if you got them like when they were lying down, maybe that would just provide a little reminder when they got forward. Because as you can appreciate, if you're face down, if you're lying prone and your patient isn't, and you apply it, that's going to be more of a rounded position than being like this would be. So I think the answer to my own question is I think you just want to take into account what your client's needs are and then apply it in the appropriate position for that. Yeah, absolutely. Yeah. And so the next comment is you could use a facial wrap in the spa. And so yeah, I mean, you know your surroundings, you know what you have available to you. I think speaking from my experience with massage therapists, the benefit you do have is that people are very comfortable taking off their clothes around you. Like things are their body is exposed, and so you probably have more of a rapport with people who are used to kind of being topless or shirtless um, than other health professionals would be. So I think that's another advantage that you have is just the comfort level that people have with you, and rightfully so. But I would say for myself again, you always want to be extra kind of cautious and make sure that people are comfortable and have as good of an experience as possible, because this is the piece that's as we said, the treatment between treatments. You want to make sure that this piece only adds to the perceived value to your treatment, to the experience with you. And so you want to make sure that the person leaves extra happy because you're applying it, not feeling uncomfortable. And the next one is thank you for your time. Well, thank you. I appreciate that very much. This has been tons of fun, and thank you for everyone's time that was here as well. I hope everyone's learning lots, and we're going to continue running these courses, these webinars every month. With the idea being is we can constantly kind of trickle down information about different ways you can use the Procuts. Give you some ideas about the ways that you can help your clients, but also be here on a regular basis to answer the questions that you have. I know that when I was learning to use kinesiology tape years ago, I had questions that came up when I was working with clients, and I didn't have we wouldn't have people that would be able to answer them for you. So they would you get like a list of clients building up, and maybe then you would kind of search for the answers. But our idea with this is, okay, we have constant touch points where you can come in and ask any questions that you have, and then everyone else that's here in their community can learn from that as well, because all the questions are going to be quite based on what you're doing with your clients, and so I think everyone has the ability to learn from those type of questions and be a better clinician as a result. Oh, for everybody. Oh yes, and yeah. So after we're done here, we'll send a link. But any questions can go to education@spidertech.com, and we'll continue to update and get back to you with any questions. In addition to, we're going to make this webinar available to go back and watch, or you can send it to friends, or anyone that couldn't be here can go back and watch later. Thank you, everyone. Fun as always, and we'll see you in a month.
Thanks for your time, Nick.